Evening. I'm Catherine Hill with Levine Museum of the New South. 46 years after Executive Order 9066 forced more than 100,000 Japanese Americans into internment camps, President Reagan issued a formal apology for the inexcusable breach of civil and human rights against a group of people based on ethnicity. In the aftermath of Pearl Harbor, U.S. policy dehumanized Japanese people. It was 129 years before the U.S. Senate passed a resolution apologizing to Chinese Americans for the Chinese Exclusion Act of 1882. That act banned all immigration from China and ushered in the driving out period, which unleashed violence against Asians and Asian Americans all across the country. Now, current and former political leaders in the US have tried to lay the blame for a worldwide pandemic at the feet of Asian people, enabling racial violence and discrimination, and resulting in last week's massacre in Atlanta. How long will it be before we apologize for those messages and that violence? Why don't we just stop hating instead? Levine Museum connects the past to the future to realize the promises of a just, equitable New South. Thank you for joining us.
Good evening. My name is Braxton Winston. I serve here in Charlotte as a city council member at large. And over the past year, us at the Levine Museum of the New South have been adjusting just like everybody else. But during the pandemic, we started a series, Shaping Charlotte, dedicated to looking and spending time doing deep dives about issues affecting our community at large, and in particular, looking at the effects on particular groups of people within our community. Tonight, we're going to try to take a look back on some of those conversations and see where some of those folks who joined us along the way are, how they're doing, and hopefully can continue the conversation about where we're going as we dealt with new issues brought to light because of the pandemic, but also dealt with issues that was always here and historical, but were being exacerbated by the pandemic. So with that said, I'd like to introduce our guests. Chavi Khanna Koneru is a co-founder and executive director of North Carolina Asian Americans Together. Ms. Koneru moved to North Carolina in 1989 and has spent the majority of her life living in the state, including attending college and law school locally at the University of North Carolina. This has allowed her to gain a deep and personal understanding of what it means to be AAPI in the South. Additionally, her legal background in voting rights has given her the opportunities to interpret and enforce laws impacting the AAPI community, including during her time in the voting section of the U.S. Department of Justice, where she focused on language access for AAPI voters. Good evening. How are you doing tonight?
Good. Thanks for having me.
Absolutely. Thank you for joining us once again. Dr. Saju Joy currently serves as the Chief Medical Officer at Atrium Health's Central Division. He is also the co-chair of the Perinatal Safety Collaborative system-wide and leads the capacity surge management and clinical optimization for women's health in the Charlotte metro area. Dr. Joy has been part of the Atrium Health medical community since joining CMC and the Women's Institute as an OB/GYN and maternal fetal medical specialist in 2010. He has more than a dozen leadership roles and committee posts to his tenure. And thank you again for joining us, Dr. Joy.
Thank you, Braxton.
And Daniel Valdez, Director of North Carolina Mid-South Operations at the Hispanic Federation, is also the President of the Board of Directors of Charlotte Pride. In his role, Daniel oversees North Carolina operations to help and support and strengthen Latino nonprofits in the communities they serve. Daniel, thank you for joining us once again.
Thank you for having us, Braxton. I'm excited to be here.
Yeah, absolutely. And, you know, as we did last time, I hope that we can just have a flowing conversation. Obviously, we have a lot to cover, but feel free to chime in if there's if you feel so moved by the conversation. Well, you know, it's been a tough year. It's been a tough year for everybody. And, you know, that's obviously a term probably getting tired of hearing of. But, you know, not all has necessarily been bad. There have been silver linings to everything, and even within the struggle. So I just wanted to start off going around the horn with the order that you introduced. What is something that you look back on this past year that you look back fondly of and that inspires you as we continue to find our way through this pandemic today?
So for me, I had a 4-year-old son, I think maybe when the pandemic started, or 3, something like that. But I had just had a daughter, and I had literally been back from maternity leave for 2, maybe 3 weeks before the pandemic began. So I got to work from home for the year, and at times that meant kids interrupting meetings by telling me that they had to use the bathroom or whatever. But it also allowed me to watch my daughter grow up this year, and she is fiercely independent and all the things that we want our daughters to be. And that has motivated me in the hard moments. So it's definitely been a silver lining.
Yeah, that work home balance has taken on a totally new definition, hasn't it? Do we want to change? Like, do we want to move away from it? Do we want to go back to what it was like pre-pandemic, or, you know, is this something that we think that, you know, we grow as a society from, to do things truly in a different way? Because it has been a silver lining, but it has, I'm sure, it had its challenges, right?
Oh, definitely. And I think at least for our org, we're going to do a hybrid whenever we go back. I do miss seeing my folks and my team, but also nice to see the kids.
Yeah, absolutely. Dr. Joy, how about you? What's something that has inspired you, brought you joy, or look back fondly on?
No, I think it's easy for me. I mean, the personal experiences, as Chavi said, obviously has been great. But really for me, it's been the workplace. I mean, our frontline healthcare workers are really, truly heroes. Seeing them attack it front and center, seeing them step up, whether it was in the ED, whether it was in the intensive care units, watching them sacrifice of themselves, especially earlier on in the pandemic when we really didn't know how it was being spread, you know, how the impact could be to them and all the precautions we had to take. Them stepping up and ready to pivot and jump in really reinvigorated my feeling of why I went into medicine, but also seeing them, all of them, every one of them, not just the nurses and the physicians, but every one of our teammates that help take care of patients who show up at our doors. That gave me incredible pride. And then to see the community step in as well, to show that recognition and thanks for the folks who were doing that, that gave me pride in the community as well. So I think really, I look at it as going, wow, proud to be part of a healthcare organization, part of the healthcare sector, seeing the community of Charlotte step in, it was impressive.
Well, the healthcare community was truly at ground zero of probably the largest, well, the quickest change and the most intense change, because, you know, you had this new disease, this new illness. You had to deal with your own human nature. I'm sure there was fear there. Mm-hmm. Mm-hmm. How is your community kind of coping with, you know, overcoming the superhuman power that you kind of had to put on day in and day out of dealing with your own personal fears, but this oath that you have to serve your community in this way?
Well, I mean, I think a great question, Braxton. I think really it comes back to the fact that it truly is an oath, and you see the folks stepping up and taking that oath to the fullest, right? And you really have to, as you said, it's been a year. During the first few months, you could go on adrenaline. you can go on, there's the fear of the unknown of what could happen, and could I take this home and infect my family? And so what extra precautions do I need to take? And then there are situations where there might be two people who also work at the hospital or in the environment. How do you separate yourself so you don't spread it? And so all those fears had to be addressed. Our support infrastructure had to be there to make sure that we took care of our teammates and made sure that they recognized you needed time off, to make sure that they're not burning out. Because as the year progressed, it was easy, right? I mean, you can run on adrenaline until the fumes run out. And even after that point, you got to make sure you are able to, you still have to provide care, and you still have to make sure that you're caring for that caregiver. And we've made a concerted effort to make sure that that has also been a priority amongst the healthcare teams throughout the country. That is a true concern. And it has to be intentional, quite honestly.
Well, I think burnout is going to be something that we might spend a few minutes on in a little while, because it's true. It's something that we were all concerned on, especially when we were doing these Shaping Charlotte combos. These were in the first few months. Everybody, as Dr. Joy said, was running on adrenaline. Basically, we were having these conversations about unknowns, and things that we had hoped would happen. So. Before we get there, Daniel, what is something that brings you joy, inspiration, or promise when you look back on this past year?
Yeah, absolutely. I think from a professional level, I've been really impressed and just heartened by the way that organizations haven't traditionally done, service or social service work, have just completely revamped their work. They were very nimble in making sure that they really align with the needs of the community, and I saw that all over North Carolina, all over the country, and just the kindness of people too. I was talking to a friend the other day who talked about how he checks in on his elderly neighbor every single day, buys their groceries for them because they have a lot of underlying conditions, and has been doing this for a long time, right? Those kinds of things, I think, bring me a lot of joy, and just seeing how organizations have really pivoted to support the work. And even though that has definitely brought some challenges, and we'll definitely get into that as we have this conversation. On a personal level, spending more time at home has allowed me to explore more of cooking recipes, to think about shows that I haven't had a chance to watch, right? I love to be out, I love to travel, and so that time now sort of was redirected to other things. And I've learned to love coffee now, right? I have the time in the morning to get up, to do coffee, and to actually appreciate it. And so those are some of the things that have personally brought me joy.
I feel like I have to jump in here. So prior to the pandemic beginning, I had never had coffee, like ever. I'd gotten through law school and 2 kids without coffee, but the pandemic did me in, and I still don't like it, but I drink it every day now.
Team coffee.
I spend a lot less money on coffee now, but I probably drink more coffee now because I finally made myself figure out the proper measurements. I always use that as my excuse, but man, I do drink a lot of coffee now by the pot. Daniel, we were talking just before this started. It sounds like the Hispanic Federation has been doing, as you said, pivoting to doing some real good work, focused on the pandemic. I think pivot has been one of those words that we have all become familiar with. And it's not necessarily cliche. It's a constant necessary. I think we're figuring that out. But Daniel, you guys released an economic report today that looked back at some of the effects of the pandemic on the Hispanic community. Can you share a little bit about that?
Yeah, absolutely. Yeah. So today, the Hispanic Federation released a report that was done in conjunction with New America that provided some qualitative and quantitative analysis of the impact that COVID has had on the Latino community. And this was done both in terms of doing surveys of the community, doing focus groups with specific groups, and also interviewing executive directors across the country that have been working on the front lines and really working with communities. And so the report highlights the impact that COVID has had, both in terms of the economic impact, but also food insecurity, housing, and a number of other issues. And I'm happy to sort of go into some of those data points as I was sharing earlier. But through this report, 49% of folks reported having someone in their household lose income or lose a job because of the pandemic, which is a huge percentage, right, compared to 33% of the general population. Also, 31% of homeowners obtain a mortgage deferment compared to 44% of their white counterparts. And another sort of data point that I thought was very significant was that 76% of respondents reported using their savings to make ends meet. And so I think that sort of highlights just how impactful COVID has been in terms of the economic impact that it's had. But the report also talks about ways in which local organizations, local governments, state governments, federal government can really think about policies and programs and strategies that allow us, as you mentioned earlier, are we going to go back to where we were? Are we going to really reimagine, right, our future and what's to come? And so I think that this report also highlights some of those ways in which we can think about how to address the inequities. And we know that these sorts of health, education, economic inequities were there before the pandemic. And what the pandemic did is exacerbated them. It shed a light on them. It really, I think, brought us a lot of attention into these inequities that have existed for a long time. And so I think that now we have an opportunity, particularly with all of the resources that are coming to local communities, to really reimagine what our future looks like and how we can make sure that we're addressing those issues long term.
Dr. Joy, you just heard Daniel give us a number of statistics about the economic impact, and we know that, as we stated in many of our conversations throughout this pandemic, that this would exacerbate existing issues, which it has. Unfortunately, in this nation, the ability to access healthcare is something that is tied to how much money you make and your ability to find gainful employment. Given some of those numbers that we just heard, but giving some of the qualitative kind of information that you gave at your, the answer to your first question about the changes in the approaches that you've had that have had to happen in the healthcare community. Has this pandemic, have you seen, we've had increased access to and the ability to get testing, to get treatments, to get vaccines. So change has occurred, but talk to me about this level of change in terms of the approach of healthcare as a right. Are we looking at it different now, or are these changes kind of surface level for now? Are we going to go back to something else?
Wow, you asked a lot of questions there, and I'm going to try to address a couple of them if I can.
Yeah, absolutely.
Right? So first, to Daniel's point, I think we also just noticed that according to the Kaiser Family Foundation, the Medicaid enrollment has also increased during this coronavirus pandemic, right? And that trend is likely because of the effect of the pandemic, including what Daniel just alluded to, the increased jobs and income loss, as well as continuous coverage requirements that have been tied into the Families First Coronavirus Response Act. So I think that ties in very well to what Daniel just alluded to, what he's finding and seeing. Now, the type of actions that we've had to take, you brought up perfect examples, right? First of all, the health inequities were existent before. This just highlighted it even more. When we had communities of color that were disproportionately getting higher levels of infection, whether it was because of congregate living or because of the social inequities that didn't allow them access to care, we identified those problems as well. And as we did, just like figuring out what was going on and how this coronavirus spread, we acted, and as your words before, pivoted. We pivoted very quickly to make sure we addressed it to those communities specifically. I mean, the examples you gave were perfect. We wanted to make sure we tested, because if you test and you identify you're infected, then you got to treat. By treat, that may be just quarantine and isolate so you don't spread the disease. treat might be educate so that they can, if symptoms increase, come on in and get evaluated and get the appropriate treatment, so we don't end up with more deaths than the 500,000 we already have in the US, right? So steps like that couldn't take place unless we first tested. And how do we test? If you know that there are inequities, we sent mobile units out to the testing sites. We went to the communities. We didn't sit there on our ivory tower and say, you come to us. We said, we got to get out to you. We got to make ourselves available. We've got to change the way we deliver care and get to our communities. And so that was something also I was incredibly proud of. We tested over 700,000 COVID-19 tests over the course of this last year through this roving testing sites that we had. We had over 290 roving testing sites, the mobile vehicles going out and affecting those disparate communities. Now we've taken that another level. We're also now focusing on the vaccine part, right? One, we still offer the testing. We need to still, because it still existed in our community. It hasn't gone away. And that's one take-home message as a healthcare provider I want to make sure everyone who listens to this knows. Our numbers are a heck of a lot lower. They're continuing to plateau out a little bit, and so we need to be careful. So as a healthcare provider, I want to make sure that the listeners share to the community, it's not gone away. It's just we're under better precautions and actions of showing that we've gotten it down from those peaks that we had in early January. But we need to continue with those efforts of vaccination. So I'm incredibly proud of our organization, but others have been doing this as well. We've not only had those mass vaccination events that we talk about from Bank of America Stadium or at the Motor Speedway, but we've also had many vaccination events, such as at Johnson C. Smith University and in our other communities throughout the Charlotte metro area, to make sure that we get to not just the urban population, but also to the rural population that has difficulty gaining access to. And so there are those types of initiatives and our daily vaccination events that are happening amongst all the healthcare communities. But the regulator of that, of who gets the vaccine, is the state, who gets it regulated to them through the national. So there is some level that we can only do so much, but I've seen a lot of efficiency in that work, and I'm incredibly proud that we are making that push very well. And there's more I can share, Braxton, but I don't want to hog the conversation. But those are 2 points, to your point and to Daniel's point, that I want to just make sure that we learned and we recognize, and really I'll add later about how we will continue to propagate the kind of care so that access to care isn't as much of a burden going forward.
Well, Chavi, when we were talking a year ago, we were talking. You mentioned particularly about mental health in the community and the ability to access and the extra strain, the exacerbation of so many inequities was having and will continue to have on our community throughout this. Obviously, healthcare and access to healthcare goes far above and beyond treating COVID specifically. Can you talk to me? What is the state of care? How's the community responded? How has it filled the gaps? Is the situation improving? Or are we heading further into some mental health crisis within our community? I know you don't have all the numbers behind it, but just from your anecdotal perspective, this is something.
Sure, yeah. I mean, I think what I want to start by saying is that whether we're talking about mental health, health in general, economic status, anything else, like the inequities in the Asian American community are routinely invisibilized because of the lack of disaggregated data. And because in most of these areas, we're not breaking things down by ethnicity, we're sort of painting the entire community with the same paintbrush. And so at first glance, it looks like Asian American communities are doing well, but we know we're not a monolith, right? And the worst impacts of COVID, both in terms of, physical impacts, health impacts, mental health, emotional impacts, have been felt by the most vulnerable within our community. So so specifically, I mean, a couple of things I want to point out is that, like Filipino nurses make up about 4% of all registered nurses in the United States. Almost 1/3 of all deaths of registered nurses have been Filipino nurses. Half of all registered nurses who are women or people of color have been Filipino nurses. And that is like, I'm stating that statistic just to show that that is not something that's focused on when we're talking about who's being impacted the most by COVID. Mental health, obviously, the rise in anti-Asian discrimination and violence, we were sort of talking about this a little bit a year ago because we had started to see that impact in North Carolina even before the pandemic shut everything down, right? We were seeing community festivals getting canceled, and very specifically, mostly those that were East Asian community festivals. We were hearing certain phrases repeated that blamed a certain population for the pandemic. And now a year later, we are, a week from this very violent murder in Atlanta of Asian women. And so all these things have had a huge mental health impact on the Asian American community. Do I think we're in a worse position than we were in a year ago in terms of that? Absolutely. And we do have some evidence of that statistically in terms of like rise in domestic violence and, more people seeking out mental health services. But yeah.
And yes, with the events that happened in Georgia last week, I was talking to a community member, and a comment they made when the newscast said, well, now they are going to be paying more attention to our Asian communities to make sure that's safe in terms of some of the responses. I guess the question was, what has taken so long? This is something that should not have caught us by surprise, because the data, qualitative, and you say not necessarily the quantitative data, but it's there that we were talking about it. So how do we come together as a community to keep each other safer now than we are doing? What are some steps? And this isn't to any one person here. Anybody who wants to chime in, what are we doing wrong? That we need to be doing different.
I think it comes back to acknowledging that it's real, that it's a problem. I think we went through one component of that last year with the George Floyd and all the other I don't even know the right word, but just silliness of behaviors last year related to Black lives being, impacted significantly, and that brought us together. I think in this case, we are also bringing forth the impact of Asian Americans and anyone who has been disenfranchised or looked upon as different. And I think that I'll tell you, I'm incredibly proud of one of my physician colleagues, Dr. David Jacobs. He's a trauma surgeon, and he just in February, Mecklenburg Medicine published an article that's racism in healthcare. And it just sort of highlights that this is not something that started the maltreatment of people of different races. It didn't start when the first Africans were brought over in 1600s, right? It didn't start or wasn't just in existence with the Tuskegee Airmen experimentation, or even earlier in the 1900s when people were experimented upon. So the level of distrust exists. So if we start off by acknowledging that the hesitancy by different members of our community who have been sort of targeted, even in the violence perspective and or in the healthcare perspective, we have to acknowledge that to start with. And then only can we continue to move forward that we have to do better ultimately. And I'm sorry.
Chavi and Daniel both talked about that mistrust, specifically as in the context of your work on Census 2020 and the difficulties that already existed in terms of getting responses, and therefore the ability to get more government support services and all type of that information. Daniel, can you talk a little bit about if and how you were able to overcome some of that mistrust on top of the difficulty that the pandemic provided? We are definitely feeling that here in North Carolina, the effects of this late census and things like that. So what was it like?
Yeah, no, absolutely. And I think that I have a lot of thoughts around this. And I actually, one of the panels I hosted earlier during the summit, one of the panelists talked about how it's important to recognize the legitimate fear and distrust that communities of color have when it comes to government entities, right? That we have a history of othering, of scapegoating communities, right? And so I think that in order for there to be all trust, I think that we need to recognize that there is legitimate concern, there is legitimate mistrust, and it's not enough for us to say your concerns are not valid because the vaccine is safe and you should take it, or whatever it may be, right? Because at the end of the day, we know that for so many of our communities, they have continuously been scapegoated. They've continuously been used as political leverage to advance anti-immigrants, phobic policies, those kinds of things. We're seeing that in the state legislature, right? They are passing anti-immigrant bills instead of really focusing on what is that we need to do to address COVID and make sure that we recover as a community and we're not leaving folks behind. And so they're taking immigrants in particularly and utilizing them for political gain instead of really thinking about how they're doing. And so one of the saddest things that I've seen is that I was hoped that we would think about our communities differently because of COVID, but we're seeing that we're sliding back into the same things that we're seeing, right? When we think about essential workers, at the beginning of the pandemic, essential workers, grocery store workers, farm workers, all of those folks were being sort of talked about and elevated. But when it comes to passing a minimum wage that supports these folks, we're now having this conversation like, oh, well, we don't know if that's necessarily the right way, right? And so I think that that we need to continue to push for legislation that really upholds the values of our country and of our community. And I think we also need to lean on organizations that are doing this work day in and day out, even before this pandemic, right? That we're working in communities, they understand our communities. And when we think about vaccinations, when we think about testing events, a lot of hospital systems, the health departments, they want to go out in the community, but they are seeing that they have to do this hand in hand with organizations that are serving those local communities. You can't just come in as a hospital system or as a health department and expect folks to trust you, right? You have to be able to bring in organizations and that have been working in those local communities to make sure that they are working with you in addressing not just the barriers that sometimes institutions and systems have in place, like, for example, asking for IDs, right? That could potentially be a barrier for some communities. And so how do you work with those trusted local community leaders to make sure that you're developing strategies that are embedded within sort of the experience and the knowledge of those organizations? And so I think that that's where we start. We start with really working with organizations that have been doing this for a really long time and acknowledging that they have a lot to contribute when it comes to effectively reaching the communities you want to reach.
Chavi, what was your experience like getting through the census 2020?
Yeah, well, that reminds me that I should have said that at the beginning. That is, I feel like we did an amazing job given the pandemic, and Daniel and I worked on one of our census initiatives together. I want to echo what Daniel said in terms of respecting the concerns of the community and affirming that they have valid reasons to be worried. I think that a lot of kind of what happens when it's people from other communities without that cultural context or sensitivity is they want to come in and say, hey, there's nothing to be concerned about. But the truth is, there's a long history of things to be concerned about, right? So did we get as many people engaged in the census as we had hoped to, or that we would have had there not been a pandemic? Probably not. But I think that we approached it differently because we are part of that community. We are using like culturally competent language, and language is the other piece of this, right? Like even whether we're talking about filling out the census or vaccinations or whatever, is that particularly for the Asian American community, because it is so diverse. And just in North Carolina, there's over 40 different Asian American languages spoken. Almost none of them, I mean, let's say pick the 4 or 5 that are most prevalent in the state and at least provide translated materials in those languages. And we found over the course of the year that that problem was maybe bigger than any of the other issues that we saw in North Carolina, because it shows up in everything, right? People can't access government services if they don't understand what's being offered to them or what they're giving up, or, you know, any of those things. And there just aren't enough resources around that. The other thing I wanted to say is also in terms of kind of addressing what's happened in the community and how we can change things is, I think, by like naming what's actually happening. So I'm thinking about what happened in Georgia last week and how and everything that happened last year, and all along the way it's been explained in some other way, right? And even when it's blamed on, say, our previous president, the truth is that that racism, that history of racism and xenophobia is part of America. It didn't suddenly appear because of Trump or Trump supporters. He just helped it grow, fueled it, right? And everything that we're seeing now, I think what we can do as a community, especially as communities of color, is at least name that and stand in solidarity against it. Because until we start talking about what's actually happening and about our history, I don't think anything's going to change, particularly not in the South.
So as an elected official, I deal with the effects of this, and I try to figure out how to, deal with those root issues. So in talking with public health leaders and management, one of the things that they have asked, I asked of them, how can I be most helpful in this phase of getting people vaccinated and making sure people are still understanding that this is a pandemic. And the number one thing that they can say is just to simply use the platform to connect to people that they are unable to connect with, right? For instance, when it comes to vaccines, access is not necessarily going to be the biggest hurdle as supply ramps up and it becomes available in many different places in the next couple of weeks and months. But the hurdle is going to be the amplified distrust amongst government, amongst medical systems, amongst folks coming in. So this is something that we have to, I think, is being recognized from a public health perspective. That is the only way we get to some sense of normalcy, whether it's returning to something or moving forward into something else. So I do what I can, for instance, putting a video on of me getting a vaccine, because as a Black male, there's a particular distrust that folks won't get the vaccine. How do we, Dr. Joy, as the public health response really is becoming a public health response, meaning that the response only happens if we are all working together, and we're seeing that very clearly. What are some tangible steps that we as individual citizens that do want to be part of the solution, how do we interact with this world, to ethically and effectively change these things that we're talking about,
Yeah, Braxton, I think you hit on it. I mean, you doing your part and the community doing their part whether it's our Asian American community, our Latino community, our African American community, having trusted individuals step up and say, I'm willing to get the vaccine, and really you should too. Because that's the reason I was sharing the part about the distrust, was because it does exist at the core, right? And so the point I would like to make is, we will only get this pandemic under full control if everyone as a collective, including our leaders and our community members who have been very supportive a year ago when we needed them to be supportive of the frontline healthcare workers, now are equally supportive of our health and public health departments to make sure our public health action gets the care out to the members that are their constituents, quite honestly, right? And so your actions, other actions by myself or anybody else on this panel or otherwise, who address it and acknowledge that there was reason for distrust before, but realizing that, again, how many millions of people have received the vaccine worldwide, and it is not a farce. It is not something, even though historically we may have had reasons, that doesn't necessarily apply here, but we have to be advocates for it. Our actions are being done by having town halls, like our lead infection prevention physician is Dr. Passaretti. She does these vaccine hesitancy town halls. We have this on multimedia approaches to make sure we communicate and educate. We go out to the community, whether it's through Keneal Coltman and all of her, Fernando Little and all the other members of our team that go out to make sure the communities recognize that we want to support that and answer their questions. Because first and foremost is the education that this is not, that this is safe, but we want to answer your questions to let you make that decision for yourself. We respect your decision if you're not comfortable at this point, but we want to answer the questions that may be myths that we can help alleviate. That's sort of step two of it. Step one is having the advocates, that is all of us. Step two is the education piece and making sure that extends. And then only can we truly spread it out enough where we can actually quell the number of the virus that still exists in our community and try to curtail those variants that are still out there. I mean, I'm not trying to scare anybody, but the reality is we're seeing a little uptick abroad in Europe. We're seeing a little areas of within the US that numbers are increasing. So we've got to take that seriously too. So work on it together. This is where community has to step in. And I'll leave it to the other panelists to see what else they think would be great ideas to build that trust and move forward with this.
Daniel, you know, one of the things is, as Dr. Joy just talked about, is that we are very much in a pandemic. We might be past halftime, but there are things that, you know, that a lot of people don't know that this pandemic is still going because of burnout, because of being fatigued by all of the changes. Many in our community are fatigued by being on the front line, you know, and having to continuously fight and triple mask to raise money to pay for the things that the family needs. How does this fatigue, how does this burnout, how do we combat this? And, you know, so that we are able to continue to shift and figure out how we do work as a public to ensure our health. Like, how do we deal with this fatigue, this burnout, and ensure that we're continuing to march down the road to overcoming some of the skepticism that exists within our communities?
Yeah, I mean, I think that's the million-dollar question in so many ways, right? Because we're all trying to figure out sort of how do we deal with everything that's going on and all of the stress that this is having on so many communities, on all of us, on all of our families. I think that as far as organizations, one of the things that we've seen, you know, the Hispanic Federation has been able to distribute over $16 million across the country to over 300 nonprofit organizations that are providing rent, food, and utility assistance to folks who have been impacted by COVID, and over $1 million here in North Carolina in particular. But one of the challenges is that organizations are being approached by health departments, by big health systems, kinds of things, and asking them to help them and to do more. And at the same time, they're getting slammed with so many requests from the community for support, for help. And so part of the challenge has been that organizations are just stretched thin, and they've lost a lot of their funding, as Chavi mentioned earlier, right? A lot of their cultural events or festivals that they've utilized for funding has not been there. And so I think that more needs to be done to continue to support organizations, not just to deliver things like cash assistance and food, which a lot of that money has gone specifically for that, but also to address like the operational and staffing support that organizations need. And I think that that's where a lot of the burnout happens, is because you're asking folks to do so much work, but not recognizing that organizations need additional staffing to be able to cope with the demands in the community. And so I think that us as a Hispanic Federation, we've been very keenly aware that that is a huge aspect of our work. So sometimes our grants are to help expand their staffing capacity so that we can help prevent some of this burnout, right? And also talking to other funders about making sure that they're distributing funds, particularly to small grassroots organizations who then traditionally they haven't been engaged with because they're small, they don't have a huge development department, right? They don't have the connections. And so one of the things that I've been doing this past year is connecting these grassroots groups to these large funders, and making sure that they know that these are organizations that they need to invest in order to continually increase the capacity of the nonprofit sector to address the growing needs and to be able to have the capacity to partner with these types of institutions in order to effectively reach folks and to deploy the strategies that we know have worked in other areas of the work that we've done. And so those are some of the things that I think could be helpful, and we need to continue to support organizations and find ways to make sure that they have their resources to be adequately staffed and support their operational growth in terms of their office space, their technology needs. All of those things are a lot of times get lost, right, in the immediate needs of COVID. And that's not to say that those aren't important as well, but they go hand in hand in order to be really successful, and particularly to address that burnout that we are seeing in a lot of folks who are out there on the front lines responding to the needs.
So how has that pivot gone? How have those larger funders, those larger funding organizations that might not have traditionally accounted for some of those quality of life things that are necessary to continue the work? How responsive have they been to understanding that and changing the way organizations that are doing the work get funded?
Yeah, absolutely. I think that we've had some success for sure with the funders that we've worked with. I think that more work needs to be done, of course. And I think that part of it too has been just for a lot of our funders, it's just they've never approached this. One example was, making sure that funders, if they're funding groups that are doing food distribution, you need to make sure that you're also funding groups that are doing culturally appropriate foods, right? Because you may be funding an organization that is providing food, but it's sort of they're not focused on the Latino community or the Asian community or whatever it may be, and so they may not be providing culturally appropriate foods. And so there are organizations out there who are doing that kind of work, and it's just a matter of making sure that funders understand why. That it's important that they continue to fund these traditional sort of food delivery organizations, but also to expand into some other groups to make sure that they're reaching groups that are providing culturally appropriate food, but at the same time bring those organizations together to make sure that in the future every organization should be able to think about the communities that they're serving, right? It doesn't necessarily need to be a Latino-led or an immigrant-led organization to be able to provide the culturally appropriate services, right? And so I think that it's a matter of both investing in organizations that are immigrant and Latino-led, but also working with those sort of traditional organizations that have been here for a really long time and making sure that they understand the changing demographics of our community and the needs, so that they can also respond to that, and by that then creating a larger pool of resources and sustainability long term.
Chavi, have you seen any possible new doors open of how the government and various entities work together or can work together? And Daniel just touched on some of the private funders. Do you have any insight or vision into that world?
So our organization's only been around since 2016, and we're still the only Pan-Asian organization in the state that focuses on social justice issues. So no, the answer is no. The easy answer is no, because what Daniel is saying is, I mean, we get so many asks, right? And I think a couple of things. One, I don't mean to be facetious when I say this, but like, you can Google things, right? Like, you don't have to reach out to an organization and say, oh, we want to reach this community. What area are they in? You can check, right? And things like that, like, you know, we appreciate the support and we want folks to keep reaching out to us. We want there to be targeted outreach to our community that is culturally competent, that is in language. But there's also got to be a little give and take there. And it's not just a matter of funding to support more people, because for our community, this work is very new. So there's not just people who are already trained in it. It is people who have the platform who can say, well, here's what, you know, as an elected official, here is what I can do. These are the things that I have power over. Can I help get you language access in this? And can I uplift the fact that these are issues that have been happening in North Carolina for a long time, or in Charlotte, or whatever the case may be? There's also, you know, the Southeast Asian Coalition in Charlotte does some amazing work, and they did a lot of providing food to people in the Charlotte area. But that sort of support does not exist across the state, because there's only so much that we can do, like, as one organization. And so I think that, like, there's just, what I feel like is that because we exist, people think we can do everything, including government entities reaching out to us to say, oh, can you connect us with, you know, folks in this county who are Asian American because we're having a vaccine drive. It's not that simple, right? You have to be able to offer the resources and say, hey, we've got all these staff members who can reach out. Can you plug us into your system so we can reach out to folks? Or what do you need? Because we're here to help you. It feels like a lot of what keeps happening, and from people who worked in the Black Lives Movement that I've spoken to, this happened a lot to them as well last year, where it's just, you're asking so much from the people who are most impacted, and then you expect them to not burn out. And most of us who do this work for our community are from this community, and we're also struggling with the same things. And that is, it's impossible not to burn out if we're not given more support, whether it's from a foundation or a government entity or elected officials or just other people in the community with more power, more money, more of a voice, honestly.
I hear that. I hear that. Again, this is something that's been a reoccurring theme. How do we deal with this burnout, right? What are the many different community responses? How do we all hold our weight in making sure our neighbors that are doing the work are able to continue and persevere through the traumas of it? Dr. Joy, your organization, Atrium, it's an interesting, our healthcare system is an interesting entity. It deals with government, it deals with business, it deals with education and nonprofits, and of course individuals, right? People every day. You guys announced some exciting news yesterday. The location of the new medical school that is going to happen here in Charlotte. It'll be Charlotte's first four-year medical school. We're the largest city in America that doesn't have a medical school. So this is news. This is history being made. It's also a reminder that change still is occurring outside of the pandemic. Something so great can also bring its own challenges, some that are historic, but some that are being exacerbated and brought to the forefront because of the pandemic. What about this year? What do you think? How do we, as we build a new medical school in Charlotte, given some of the conversations we've had, given some of the hurdles and the barriers, what lessons do we take from this past year as we enter this new journey in Charlotte's landscape?
No, thanks, Braxton, for bringing that up. And we're incredibly proud to be able to work in partnership with our Wake Forest School of Medicine, which is now part of Atrium with regards to the Wake Forest Health, and the support that we received from the state, from Mayor Lyles, from really the community to show the importance of what a medical school here will do and bring to the community. In addition to the economic and the jobs that it will create over the course of the next few years, it will also be focusing in on our vulnerable population, the inequities that are already in place. Part of this this announcement that came out yesterday emphasizes this scholarship. It's a name for Bishop Battle. This scholarship will have over $10 million, will have up to $10 million in it, and it will be focusing on funding educational opportunities for our vulnerable and talented students from our Charlotte communities, specifically minorities, so that we can emphasize and work to eradicate the health disparities in our community. The concept there is you identify the talent in our local areas. They train here, they stay here, they work locally to give back and provide care to our communities. So it's really planting the seeds right now to allow it to flourish more of our healthcare providers of the future. And this will not only enhance patient care, it will bring new jobs, as I said. It'll also have the other things that Wake Forest brings, along with our Atrium in the areas of research. You know, again, the emphasis is reinvesting in our communities, and this is just one way. It's exciting to see the fact that it will be a beautiful brand new area and building, and the pictures that will come from that. And but it's also reinvesting in our communities and knowing that it is for our communities that this is happening. So I'm incredibly proud about that. And I'll also just, one last comment. You asked about what I was proud about over the course of the last year. Besides the actual healthcare workers, the frontline teammates that were involved, I think the services that we provided in the form of tele and virtual health is something I'm incredibly proud of. I think this allows us to focus on two things. One is just, again, going to the patient and providing them care where they are, so they can receive the care from a physician visit or a PA visit or whatever from their home or from their area. But we'd also identified an area of opportunity, right? Most of our patients may have access to a cell phone, but the wireless network, how many areas are dead spots where we don't have wireless access, which would allow, whether it's for education or for healthcare or whatever, that needs to be addressed, but that needs to be a community response, not just a healthcare response. So, you know, again, we can problem solve some of it, but this is where the community partnership to help impact the care in our desperate areas and the inequities that are there, those need to be addressed as well. And then really, whether it's healthcare, whether it's education, everything actually gets better.
Well, thank you all for another excellent conversation. Real quick, I'll give everybody a last word. One sentence or two. A year from now, when we're back on this panel, what are we looking back at on 2-year anniversary of COVID? What is the response like? Are we still moving forward, or are we still in the middle of this thing? Chavi, why don't you start?
I'm gonna let Saj start.
Yeah.
Well, the COVID part, I think, and I'd like to believe the efforts that we put together and the fact that even we're getting together here to emphasize the importance of getting everyone taken care of, that is true community. I think that will be better. And I think when we look back in another year, we'll see that we grew together as a community. And I'm looking forward to that.
Daniel.
Yeah, I mean, I think it's important for us as a community to recognize that that the effects of COVID are not going anywhere. People of color, low-income folks are the first to feel economic downturns and inequities and the last to recover. And I think that as a community, we've been working really hard around economic opportunity and not being 50 out of 50. And I think that if we're really thinking about continuing that work, we need to make sure we double down on ways that we can address the inequities that exist in health and education and wealth, and that a lot of times that COVID has really exacerbated. And so now we're actually starting probably further behind than we did when we released that report here in Charlotte, right? And so I think that that's something that we need to keep in mind, because it is not just about COVID, but the educational gap that folks have had, kids, all of the issues that we're seeing, the wealth loss as well. All of those are real things, and we need to really work really hard to continue to do that. And we cannot lose sight of that if we want to really not be in this spot 10, 20, 30 years from now.
It's impossible to do this work and not have burnout if you are not optimistic. And I also want to end this on an optimistic note. I think 2 years from now, I think the silver lining in all of this is that it is bringing to light the inequities. I think the demographics of North Carolina have changed. I think that we have enough folks here who want there to be real change, that 2 years from now, we're going to be talking about how we address these inequities, we got the pandemic under control, and that we all supported each other in the state.
Well, I do always love to go out on an optimistic note, and that was it. So I want to thank all my guests, all of our guests for joining us tonight. I want to thank all of the Levine Museum of the New South family and audience that is out there watching. This is Women's History Month, and I encourage you to always take a look at all the other stuff that Levine has going on the website, on Facebook, on Twitter, and you can even join the museum on next Tuesday at 11:30 for Women's History Month Lunch and Learn with Dr. Jennifer Dixon McKnight, as she shares how the 1969 Charleston Hospital Workers Campaign pushed the boundaries of what was considered acceptable for working class Black women in efforts to fight for their own rights. You can find that link at museumoftheNewSouth.org. And again, thank you all for joining us for this wonderful conversation, looking back at how COVID-19 is shaping Charlotte. Thank you very much.
Thank you.
Thank you.
Thank you.